scoot a little bit to that direction. All right, so now again, what I'm going to do is I'm going to cross the patient's arms, and you keep him, you tell him to hug yourself, keep yourself tight in this position here. Now again, you see I'm going to use this as a lever, so I can rotate the patient a little bit like this, so I can get around the patient. So you find, again, whatever one would be in question. And once you find that segment, I take my hand, I take a tissue pull, again from I to S. Then what I'm going to do is I'm going to tell the patient, when I tell you, I'm going to have you tuck your chin here, and I'm going to kind of pull you up, you come up with me a little bit. So I get myself positioned here. So I'm going to take a step to the inferior, just have you tuck your chin, come up a little bit more with me, right here. Then what I do is my hand comes down. Once my hand comes down, he still stays tucked, and then I would, that was actually my fingers, then I would thrust it. Because I did it so slow. But then I would impulse down. So I would come around, and then I would impulse down. So, you know, this hand was down. A lot of times I take my pinky and just let it kind of sit out just to stabilize. I don't know if you saw that, but
I don't think so.
pinky. So I usually do it in this position. This is on the area with that. So again, but everything is done usually with momentum. Sometimes you have to take the patient, and you got to find that out once you're there. You know, once you're in this position here, and again, I would have him tuck his chin, come up with me. See, so I like to sometimes take him up much higher.
Yeah.
So now I got him, he's sitting here. Now when I come down, I got much more momentum to go down, because it's mostly him doing this whole thing, not me.
Mm-hmm.
You know, and as he's coming down, then I can just impulse. And again, I'm using right here to impulse down. Some people do it this way, here. You got to be careful as the female doctor, you don't get these elbows in your breasts, because that's going to hurt. So you got to make sure, you know, that you got this secured here, so when you come down, you know, you're not going to whack into here, or you got this down like this. You got to protect your chest, you know, in that fashion.
Could you just do it all the way through without the thrust again, please? But like faster, not slower.
Yeah, but again, you would position the patient, take your contact, have him curl up, comes this way, and down. That was him, yeah. And down. See, it was all done quick. But again, it's all these, there's a, you know, again, there's a lot of mechanics to this adjustment.